Welcome to Thoughts from an Old Man. In other words, me, Warren Lieberman, yakking. I've been a student of life for over 80 years, and I've been a soldier, teacher, salesman, and administrator of a religious nonprofit, and on occasion, a doer of stupid things. Well, that's another video. Hope you enjoy this episode of Thoughts from an Old Man on youtube.com/@WarrenLieberman1816. Please subscribe by clicking on the button on the bottom right of this video. If you want to learn a little about growing old, please stick around and watch this video. By the way, there is no secret. I've spoken about Stoicism's concept that death is part of life, and I want to share some thoughts about this from the book Being Mortal by Atul Gawande, which I read several years ago and reread recently. Gawande is a surgeon, writer, and public health advocate with significant insights. In this video, while overtly about death, is really more about life. It is about knowledge and, more importantly, about choice. Atul Gawande writes about how Western medicine has made great strides in prolonging life. While this is true, the medical industry has hit a wall in dealing with its limitations. The human factor of expectation is often overlooked by medical professionals, patients, and families. More positive outcomes are expected than can be delivered. During times of serious illness, hope and recovery are offered. The outcomes and journey sometimes can be a bit different from what is expected. Patients often endure aggressive treatments, which come at the cost of pain, loss of mobility, loss of independence, and diminishing improvement, and the ultimate negative outcome, death. I'm not advocating for the avoidance of medical care. We can replace hips, knees, transplant organs, bypass heart arteries, remove disease organs, and dispense medicines for the treatment of a variety of diseases. And in most cases, the results are positive. Myself, I've had 2 knees replaced. One I give a 95% positive grade, and the other is hovering in the high 80% range. Gallbladder removed, the acute pain is gone, no issues. The cancer was removed with only minor remaining issues that are not life-threatening and barely noticeable. I only take a small number of medicines daily. I consider myself fortunate with relatively good health. However, I'm always aware of the unforeseen events. I myself had an ER visit because of fainting twice and bleeding after a blood donation. Gawande's book tells stories of very aggressive medical interventions that were almost tragic, and the resulting difficulties the individuals had to endure. I've seen similar situations and have them filed in the back of my head for future reference. Life and medical care are full of choices. How we handle ordinary choices is different than how we handle hard medical choices and options. How we handle and how the choices are presented is the key in the decision process. In dire medical circumstances, we are offered choices and hope without too much attention given to the risks, the downside, and possible negative consequences. We are almost always control our actions in normal circumstances, except when we approach the end and face hard choices. Then others, mainly family, have a voice, with and without our input. This omission is sometimes unavoidable. The patient is incapable of participating or merely ignored, or the decider doesn't know the choices, the patient's wishes, yours. The real dilemma comes during that moment when a decision must be made. When does the hope of recovery from a serious illness begin to seem like a distant dream, and the reality sink in that further treatment is useless? The lesson of being mortal is not how to avoid aging and illness, but how to remain human and be in control. With the help of family and friends, expectations can be fitted into the equation of the final decision making. Right now, these thoughts seem very academic. I'm okay today. You are well. But the black swan event is lurking behind the next corner, just out of sight. My wife and I faced the black swan when COVID struck. We caught the virus with the same near disaster results the same day. 2 weeks of struggles before a slow recovery. We were mere days away from hospitalization before cough syrup, Tylenol, and chicken soup kicked in, along with the natural waning of the virus's grip. Even 6 years later, we are aware of the possibility of an unforeseen event striking again. It's difficult to find a way to offer proper advice to help face these situations Gawande presented in his book. The only suggestion I have is to have open communications with your family, your partner, and medical staff. And these days, sometimes the medical staff only meets you when you enter the hospital. Your preferred family doctor is not present. I'll end with a positive note from Atul Gawande. Our ultimate goal, after all, is not a good death, but a good life to the very end. Being Mortal is not a scientifically researched book. It relies on anecdotes to make its case, but it does so in a readable and convincing manner. I reread Being Mortal and came away with the hope that discussions with my family will prevent some of the struggles which we face at that point in life's journey. And you should have these conversations with your family also. Hope you learned something of value in this video. Please click on the subscribe button on the bottom right of the screen and share with a friend. See you next time at youtube.com/@WarrenLieberman1816. One final word, still creating at 80 plus.